really excited to be here, and I'm thrilled to be able to speak after lunch when you guys have been doing what I'm passionate about, communicating and learning and interacting with each other. Today I'm going to be talking about interventions for apraxia in children with autism. Here's the definition of apraxia by Edith Strand in 2017. The ones at the top are things that are often present, behaviors that are often present but aren't discriminative. In other words, if the children have these characteristics, they may have apraxia, but they may not. Limited consonant and vowel repertoire, use of simple syllable shapes and frequent omission of sounds, numerous errors, poor standard scores on articulation tests, and poor intelligibility. That sounds like a lot of our kids, right? But it's not definitely apraxia. Some more discriminative characteristics are difficulty moving from one articulatory configuration to another. In other words, it's movement between sounds, not just the production of sounds. Groping and trial and error. If you see a child trying to make a sound and their mouth goes in lots of different ways, that's a signal. Bowel distortions is a common characteristic. Prosodic features, speaking in a very staccato way, is often a feature, and inconsistent voicing errors. So they might produce voice sounds as voiceless and vice versa. Now, as you can see by all of these, you need to have some speech before you can tell if apraxia exists, right? And sometimes what we're looking at with our little guys and sometimes even older kids is not that they are exhibiting apraxia, but they're really not making many sounds at all. On top of that, we have things that are specific to autism that could also explain their difficulty with speech sound production. So we have lots of things that we have to consider. We have lack of attention to the face, lack of attention to people talking, reduced facial gazing, absence of sounds being reinforced with reinforcing things. Let's take, for example, the little infant, right? That if they're loving being snuggled and nurtured in their mother's arms and their mom's cooing and making sounds to them, and that's very pleasant, right? Then those sounds become associated with being fed and being cuddled. On the other hand, if you have a baby that doesn't feel good and they're trying to move around and they're arching their back and they're trying to get away and those sounds are being made, then those sounds aren't associated with good things. We also have difficulty imitating, right? Just as a characteristic of kids with autism. We have reduced social motivation, as we've heard about this morning. We have motor planning difficulties in other areas of their body, and we have a lack of practice producing sounds. We don't get that typical babble a lot of times in the cooing that we see in typically developing babies. And then we also have a lack of variability of sounds produced. So all of this, what all of this tells us is that it may be apraxia, it may not. But you know what? It really doesn't matter, because no matter what the etiology is, we know that we have things that work. So what I'm going to share with you today, or what the research shows at different levels of speech production, what works best for the children. But we always have to know that not all of these procedures are going to work all of the time. I was working over at the school, and some kids were just responding exactly like I expected them to, and others weren't, right? We have to think of these teaching procedures as tools in a toolbox and try different things and try to match the current skills of the child with what we want them to learn. We also have to make sure that while we're teaching them to talk, we're not letting go of communication, right? We need to have some sort of augmentative system. Maybe it's sign language, maybe it's PECS, maybe it's a voice output device. But that doesn't stop kids from talking. It just augments their ability to communicate while we're teaching them to talk. So it's not an either-or situation. So let's talk about this kid. I'm sure you've seen him, right? We have children that have very little sounds. They're pretty much silent, or they lack a variety of sounds that they make. They might make just one sound all the time, da 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 da, right? That might be all they make. Or they're pretty much silent. So these are some things for children that look like that can help. The first thing we want to do is encourage some back and forth vocal play. I stole a quote from Dr. Minad, where is he, this morning, that I love. The voice, let me see if I get it right. The voice is really an instrument of connection. Yeah? That ability to use voice and to use speech and to use language has to be done in the container or the context of a social connection. Otherwise, it's pretty much meaningless. If I sit at a table and just have you practice sounds or have you practice movement, it's not what it's intended to be, and it's not addressing the core problems that we have with children with autism. So we want to get this at back and forth vocal play, imitating sounds the child makes. Presenting sounds while the child is doing his most favorite things. We're going to pair or associate sound making with the things the child loves. When we heard about the reinforcer pathways, the reward pathways, right? It makes me think about what we need to do to make sound very rewarding for children. Provide a preferred item or activity right after a child makes a sound. I had a child that would say ba, 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 and loved bubbles, but there was no connection between saying baba and getting bubbles. So I had mom carry around a container of bubbles, and whenever she'd hear him start saying that, she'd pull it out and blow, bubbles, bubbles, and pretty soon it became more intentional that he would say bubbles to get the bubbles. Provide a model of a sound you've heard the child produce and deliver, I've already said that one. And then use a lag schedule. This is Barbesh's research that basically if you want to get change, if you've got a child that's just producing one sound, you're going to reinforce or give them something they really like only if they produce something different on the next trial than they did from the last time. And here's an example of a little child where we're associating his sounds with his favorite things. He loves Thomas the Train. Is that a popular thing here? The trains with kids with autism? Yes? No? Yeah? It's very popular in the States. Okay, can you play this one?
Oh, fall down.
He didn't like that.
Oh, fall down.
So then he starts making the sound, right, that I made when it was associated with his favorite activity. And it's kind of like this dance, right? So what did I notice? All right, he likes the train. What can I make up that's meaningful and make myself part of that? And then when I noticed the fall down, I did it once. He didn't like that, but then he imitated it. So he liked it, but not with me controlling it. So it's just constantly noticing how is my behavior affecting his behavior, and what do I need to do to change? It's kind of like a dance. Now let's look at kids who are producing some sounds but not yet imitating consistently. We can say a sound, the stimulus-stimulus pairing and the man-model procedure can be kind of combined in vocal imitation training. These are all research articles that I encourage you to read that are really good. But basically what I do is combine that with the work of Kegel et al. And a lot of people that are doing work on requesting, teaching children to request or mand, and put it all together. So what I want to do is make sure that I'm working within the context of something the child loves, right? So let's say, for example, a child likes cookie. Rather than having them say ma, and then giving them some cookie, I'm going to have them say because that's a sound that's in cookie, right? And once they can say I'm going to do k. And once they can say k, I'm going to do k-e. So I'm going to shape within a word shell, but using the sounds that are in the word of the thing that I'm giving them. Does that make sense? Instead of giving them a reinforcer for saying something else. And considering the role of parody just means that all of us, children especially, but us too, we want to do things that we're successful at, right? And we like to match the people around us. Sometimes when I noticed when they were singing and I was getting lost, I would just stop because I didn't want to try and fail, right? Or I say Trivandrum because when I try to say the other name, I can't, right? So I don't try. We all have that motivation to be successful. And so we want to say, give the child a word or an approximation of a word that they're more likely to be able to say. Vowels carry the most meaning. So I'm going to usually produce the vowel first. You can understand if a child said e, you might know what they want. But if they said k, that could be anything, right? So we want to make sure that we start with those vowels, and then we create syllables, move into syllables as quickly as possible, rather than working on isolated consonants, or rather than giving a whole word that they can't possibly say and expecting them to say it, because the chances are they won't try, right? Another thing to consider is the role of what we call behavioral momentum. If I do something I'm good at, and then I throw something in that's hard, I'm more likely to try that hard thing, right? So if I'm having trouble teaching a child to imitate, but they can imitate other things, we might imitate tapping a drum, and we might imitate putting our arms up, and then we would throw in, right? So then they're more likely, I did two things really well, I'm more likely to try that third thing. So this is an example of a child imitating him. He starts imitating me. We're working in a context of something, again, we're creating that container for communication. This is something that he likes doing. And I want you to notice how much he's looking at my mouth, how much he's looking at my face, how engaged he is. Those all have to be part of your therapy when it comes to teaching a child to talk. So he's trying to imitate me now, right? So we have this sustained back and forth interaction in the context of social engagement, right? That we're putting the sounds and the communication into. And this is an example of a little girl. I'm very bad at clipping videos, excuse it, but she starts out with pecs. But to show how we can use reinforcement and watching what the child is enjoying doing to create meaning out of the sounds that they produce. So what you'll first hear is that she'll fill in a sound, right? And then what you'll see is she'll look at me and kind of produce it a little bit more intentionally. And then the last time is a very clear communication using just a sound. Go ahead and play this one. Book. Book. Let's see. B. 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 On. She just said that, and I made up that it was on. Oh, goodness. Stop. Turtle. Hi, Turtle. Give me Turtle. Thank you. Good girl. Give me B. Oh, that's nice. Thank you. Put the B on the flower. Turn it. And there it goes. Now she did it in response to my filling. Right? Got up. Oh, down. Uh-oh. She didn't like that. And stop. Fish. Turtle. On. Oh, okay. That was a very clear communication, right? You can't be afraid to look like an idiot if you work with kids with autism. Round and round. So the third one you could see was a very clear, intentional communication, right? She didn't want me to knock those things over again. She wanted me to turn it on, turned to me and just went, ah, right? And I could shape that into a word. Now, for children who attempt to imitate, so now we've got them imitating, we've got them producing a lot of sounds, they're attempting to imitate, but they're having a really hard time producing the sounds, making the sounds in the right place. Some ways we can prompt them are with hand cues. There's some research coming out, it's in press right now with Tammy Casper, that's one to keep an eye on, and Lena Slim Topjan on using specific hand cues. We use the hand cues from Easy Does It for Apraxia, and have used those for a long time. Then using tactile cues, touching the part of the mouth where they're supposed to make the sound can be helpful. Lena and Tammy have also found that teaching the child to imitate the hand cues allows them to prompt themselves. And then again, shape in the context of requesting. So they're motivated and they want to say these words and they want to use those words, plus they'll be more likely to practice, right? So we're going to use word shells to shape successive approximations. And the word shells are what I talked about earlier. Maybe it's saying ah and then ball, or ah and then on, right? Now this little girl came to me and didn't really have any social approach or social motivation. So I found out that she loved horses. So I just got a bunch of horse toys. And what you'll see me using is an OGCOM system, is just a topic board that goes with this game, just to supplement and expand some of the language while we're working on the sound production. Go ahead and play the video.
Let's get this table. Nay! Nay! Yeah. Gotta get the horse. Horse. There's a horse. Horse on top. With the horse?
She's imitating now the sound and the hand movement.
Okay. Not big or little? Little horse. Little horse. Nay! Nay! I'm thirsty. I want a drink. The horse wants to drink, Gabby. He needs to drink. Need some? What do you want?
Keep control of all the toys, right? If they need you to get to them.
There's big horse. Need some water. Push, push, push. Need to push.
So she's getting some syllables there.
Push, push. You got water? Gonna get a drink. Drink, horse. Did. Horse is taking a drink.
She's imitating the syllables.
Drink. Uh-oh, we poured it. Drink, horse. Uh-oh. Drink.
So again, working in a social context, right? Working with something that's reinforcing, saying things that matter to her, right? And then she's more likely to imitate me, and she's more likely to try. Simplifying the words. She's not going to say drink, but she can probably say dig, and I can shape that to dink, and then I can shape it to drink, right? So for children who have difficulty using sounds and syllables flexibly, think about it this way. If I'm only working in the context of requesting, and let's say we know that sometimes our children have restricted interests, right, that they're not playing with a whole bunch of variety of toys, then those sounds get really tightly linked together. In fact, too tightly linked so that we're not getting that flexibility of speech production. And so we want to now start introducing a little bit more drill work that keeps that sound system flexible. There's a couple ways to do it. The rapid syllable transition treatment is for kids with apraxia, not necessarily with autism, but we can combine that and blend that with. And the way I do that is, let's say, for example, a child has mastered saying ball, right? Or ba for ball. I don't want it to always be ba. I want them to be able to say be, bye, bay, bo, right? To keep that system flexible and fluent, and they're not always saying the same sound right after one after another. So I can do some fluency sprints, or in other words, rapidly teaching them to say one sound after another that contain the same syllable structures as the words they're using in their requests. Here's an example of that. You can go ahead and run that.
I see. Here we go. I'm going to start our timer. Okay. Say bye.
Bye.
Very good. Say baby.
Baby.
Excellent. Say dada.
Dada.
Nice. Say papa.
Papa.
Very good. Say nap.
Nap.
Try again. Nap.
Nap.
That was much better. Say pop.
Pop.
Excellent. Say bubble.
Bubble.
Very good. Say bed.
Bed.
You are so awesome. Say bat.
Bat.
You got it. Say body.
Body.
Yeah. Say hat.
Hat.
Awesome. Hi, kids. You can go play.
So he's just learning how to do the fluency sprint, so she's giving feedback after every single one, right? She's telling him if he did a good job, or she's giving him a correction if he didn't. We fade that out until we're just doing 1-minute trials, and we just go as fast as we can with as many different syllables as we can to get that system nice and flexible. So I wanted to share kind of a story with you about a little girl to kind of see how this all fits together. I know Dr. Lord was saying earlier that we really need to make sure we're getting speech early on. Well, this little girl came to me at 6. Whoops. Oh, no, stop. This little girl came to me at 6 years old, and she had no speech, no way to communicate, no signs, no pecks, no voice output. The only way that she communicated was to take her knee and ram it into her forehead. So she had this big knot on her forehead all the time. And she would just do that until somebody would figure out what she wanted, right? And so when she came to me, she had a lot of therapy that maybe wasn't the best fit for her. She had learned how to touch a bunch of words, but she didn't, then the next step was to say car. And she would go, no, say car. No, say car. And then she would start hitting herself in the head with her knee because she could not say car, right? They were asking her to do something that she was not capable of doing. And because she could do it sometimes, there was the belief that she was just not trying. And she clearly has apraxia. And so anyway, we started working. I had to kind of start in the room way far away from her. And just got a bunch of toys that I know that she loved. Her mom told me that she loved all the Disney stuff. So I got a bunch of Disney toys, and I sat in the corner way far away from her and just played and had a blast with the toys until she started moving closer and closer. And finally, she started interacting with me. And when they sent her to me, they said that she was stubborn and she just didn't want to talk. Well, I want you to look at this little girl because her mom's in the room with me. Her mom worked really hard with her, too. And she's trying really, really hard. And every time she says something, she'll look over at her mom like, did you hear that? Right? Go ahead and show the video. Yeah. Let's get the music. Let's see. Which one do you want? What do you think? Hiss? Kiss. Kiss. Try one more. Kiss. There you go, girl. She's working really hard. Kiss. So that time I tried to shape it to on, right? She got the ah, and I tried to get the on, and she made a different sound. She said ah-ee. I didn't want to reinforce that, so I went back to the ah. With the word shells, that's what we do. We can be fluid. If you're doing really well at this level, I'm going to try the next step up. If you have trouble with that, I'm going to step down, right? Because I want you to be successful, but I don't want to reinforce adding sounds or reinforce errors. Did it look like a little kid that didn't want to try? No. She was very motivated to communicate. Once we got her in a context where she could be successful, and once we used things that were motivating for her and reinforcing for her. So this is her this was 2 years later. So we went from 6-year-old to 8-year-old. And again, nonverbal completely at 6. She had nothing. And this is her 2 years later. Go ahead and play the video. Hey.
These.
What are those?
The food.
The food and the
Dishes.
dishes. What do you want to play with?
Dishes.
And?
Food.
Okay.
Dishes and food.
Okay.
I have spaghetti.
Spaghetti.
One in a bag.
It's in the bag. Say spaghetti.
Spaghetti. Dinner.
Spaghetti patty. Okay.
Wow.
I need your videographers. I'm not very good at this. So what are we going to eat?
Cougar.
What are we going to eat? The
Hot dog.
hot dog. Cook it on the grill. Be careful, it's hot. We need the bun. We need the bun. Put the hot dog in the bun. Thank you.
I will okay.
So we've got some pretend play going.
Yes. You know what? Yes. Eat.
What should I do?
Easy. Hot dog.
Oh, I want some ketchup on it.
Ooh.
I love ketchup.
No. Cream.
Not ice cream.
No. Ketchup. Find the ketchup.
Oh,
Found the ketchup.
good job. Squeeze. Thank you. I love ketchup on my hot dogs.
I'm finding mustard.
I don't like mustard.
No. A ketchup.
Well, empathy.
Ketchup. See?
More ketchup. You taste it. It's too hot. It burned my mouth. What should I do? Blow on the
Hot dog.
What should I do?
Blow hot dog.
Blow.
On hot dog.
Okay. Now what?
Eat hot dog.
That is so good. I love hot dogs. You want a bite?
Yes. Okay. I love ketchup. See.
I love ketchup too. Imitating the sounds.
Delicious hot dog.
Is it delicious? Good. It's not too hot anymore.
No,
I'm glad. Can I have some French fries with my hot dog?
Okay.
Thank you.
Eat fries hot dog.
Eat fries and hot dog?
No. Yes.
What should I do?
Eat fries in hot dog.
Okay. Oh, that was wonderful. Thank you very, very much. But you know what? I'm thirsty.
Get some drink.
She had that language now, right?
Here.
Oh, what is it?
Juice.
Oh, thank you. Can I have a cup?
In there.
Thank you. What should I do?
Pouring on the juice.
Pour the juice?
No, pour in the water.
Pour in the cup?
Yes.
What should I do?
Pour in the cup.
Okay. You see her struggling a little with the language. Are you thirsty?
Yes.
Here's a drink.
Get some water.
That tasted good. I'm ready for dessert. What's something I could eat for dessert? We can stop it there. I wanted to go through the last one.
Waffle double.
Okay, I'm going to stop it. So that goes on a little bit more, but as you can see, we've got all the pieces in place, right? We've got the social context, we've got the pretend play, we've got the back and forth communication, and then we're still working on shaping sounds and shaping language within that context. She's learned to have many conversations about things, and clearly she still has some speech problems, but her motivation to communicate and her motivation to get her point across is still there, right? So I want to end with this little one. This is the one that was doing at the beginning, that was just learning how to produce sounds, and we taught her this for her mom for Mother's Day. Go ahead and play the video.
I love you so much. I love you so much. Now I can tell you how much I love you.
And we'll stop there. Here's some references for you. I highly recommend reading some of these research. There's a lot of good papers coming out of a lot of different fields on increasing communication. I'll scroll through them if you want to take pictures. Or if you would like the PowerPoint, you're welcome to contact me. Thank you very much for your time.